Your colleague is out sick. The reports are due tomorrow. She sends you a link to the folder containing the code that she wrote for this project. She says double click on this file and it will generate all the reports that you need. After you downloaded the project code, open a folder and double click on one file that executes code that runs in your terminal. A few minutes later, your reporting folder gets populated with new professional and branded Word, PowerPoint, and Excel files, fully updated with the latest data. No copying and pasting from 5 spreadsheets, no formula errors, no formatting by hand, just with a double click on a file. That is what automation looks like in public health, and that is exactly what you will learn to build in this course. During COVID-19, health departments that had automated data workflows could generate situation reports in minutes. Teams without them were working nights and weekends just to keep up. The pandemic exposed a critical skills gap, the ability to build reliable, repeatable reporting systems under pressure. This course exists to close that gap before the next outbreak. This course will teach you the skills I found most helpful working during the COVID-19 response and during my time at the CDC. Over 10 weeks, you will go from running someone else's workflow to building your own from scratch. Importing data from CSV, Excel, or REDCap, cleaning and validating it, producing publication-ready tables, visualizations, and branded reports, and scheduling the whole thing to run automatically. Everything uses free tools, R, Quarto, and Windows Task Scheduler. No prior coding experience required.